Okay, let's unpack this. Imagine facing a really serious injury, something like a bad crush injury or maybe a significant burn. Beyond just the immediate pain, there's this hidden battle happening inside your body. The damaged tissues are, well, they're desperate for something absolutely vital, oxygen, and they're just not getting enough.
Mm.
So today we're doing a deep dive into that whole challenging situation. We want to understand what's going on inside your body when severe trauma basically starves tissues of oxygen.
And crucially, how a treatment called hyperbaric oxygen might play a role.
Yeah, exactly.
We're looking at information from a chapter that focuses, specifically on these acute traumatic ischemias and hyperbaric oxygen.
Right. And our mission here is really to cut through the medical jargon, make it clear why oxygen is so critical for healing these really severe injuries and, what this hyperbaric oxygen treatment actually aims to achieve, especially if you or someone you care about are going through something like this.
Okay, so the core problem really starts with the injury itself, the trauma. Whether it's a crushing force, a bad burn, whatever it is, it often damages the blood supply, the tiny vessels in that area.
Right.
And when that blood supply is compromised, the tissue just doesn't get enough blood flow. And that state, that lack of blood flow, is called ischemia.
Ischemia, okay.
Uh,
And less blood flow means less oxygen, obviously. I guess that just slows healing down, but the source seemed to suggest it's actually worse than that. Something about a vicious cycle.
That's exactly right. Yeah, it's not just a slowdown. It can trigger this really harmful feedback loop. So the tissue is already starved of oxygen because of the injury.
Uh-huh.
And its reaction is to start swelling up. This swelling is called edema.
Okay.
And the edema, the swelling itself, physically squeezes those already damaged blood vessels even more.
Wait, hang on. So the swelling makes the lack of blood flow worse.
Precisely. It feeds back on itself. Less blood flow from the swelling means even less oxygen gets to the tissue.
Oh.
That state, the severe lack of oxygen in the tissue, is called hypoxia.
Hypoxia.
Think of it like a garden hose. You've got a kink in it, right? So the water flow is already reduced.
Yeah.
But then the hose itself starts to swell up right around that kink, pinching it even tighter.
Mm.
So even less water gets through to the, thirsty plants. Your injured tissues are those thirsty plants.
That's a great analogy. Okay. And normal healing, I mean, that needs a lot of oxygen, doesn't it?
Oh, absolutely. Wound healing it's incredibly complex. You've got different stages, the initial cleanup, dealing with inflammation,
Right.
then building new tissue, new blood vessels, all that repair work, and finally remodeling to get strength back. Every single one of those steps needs oxygen, lots of it. But the injured area is stuck in that awful cycle of swelling and, well, oxygen starvation.
Okay, so that brings us to hyperbaric oxygen therapy. How does it try to sort of break that cycle? What does it actually involve?
Right. So with hyperbaric oxygen, the patient goes inside a special chamber. And in there, they breathe 100% pure oxygen. But here's the key part. It's under increased pressure, higher than the air pressure we normally experience.
Okay, higher pressure. What does that do?
Well, normally oxygen is carried by the red blood cells, right?
Yeah.
Under pressure, though, a whole lot more oxygen gets dissolved directly into the liquid part of your blood, the plasma.
Into the plasma itself,
Yeah.
not just on the red cells.
Exactly. Think of it like forcing more gas into a fizzy drink under pressure. More oxygen dissolves straight into the blood fluid.
Ah, okay. So that dissolved oxygen can then reach places where maybe the red blood cells are struggling to get through because of the swelling and the damaged vessels.
That's precisely the idea. This extra oxygen, dissolved in the plasma, can basically sneak past those kinks in the blood vessels. It perfuses, or spreads into, those areas that aren't getting enough blood flow, delivering oxygen directly to those hypoxic starved tissues. It helps them survive, helps them function.
Yeah. Okay, that makes sense. And what does delivering that extra oxygen actually do for the healing process itself?
Well, several things. First, by getting oxygen to those struggling cells, it improves their chances of survival. It also seems to help reduce that harmful swelling, the edema we talked about.
Ah, so it tackles the cycle itself.
Yes, it helps break that cycle. Plus, oxygen is crucial for fighting infection, so it supports your body's immune cells in the wound. And fundamentally, it provides the fuel needed for the cells that build new tissue, new collagen, new blood vessels. It supports all those repair stages.
And the source mentions specific situations where this might be considered.
Yeah, it's typically discussed for really severe cases. Things like certain complex crush injuries, some types of serious burns,
Hmm.
also complicated wounds, maybe where skin grafts or flaps are needed and their survival is threatened because of poor oxygen supply.
Okay.
And sometimes even in really critical situations, like trying to save a limb where amputation is being considered or after a limb has been reattached, trying to maximize tissue survival.
So it sounds promising for those specific severe scenarios. But is it like a guaranteed fix? What are the outcomes generally?
Yeah, it's really important to be clear. It's definitely not a magic bullet, not a cure-all. But for these specific, very challenging types of injuries, the evidence discussed in the source does suggest it can be a valuable addition to treatment.
An add-on. Okay.
Yes. It seems to genuinely improve outcomes in some cases. The source suggests it might lead to better healing, fewer major complications, and it even mentions potential improvements in the range of, say, 20 to 30% better results compared to just standard treatment alone in these difficult cases.
Right. So if we bring this all together then, severe injuries can create this really tough environment inside the body where tissues are just starved for oxygen, making healing incredibly hard. And hyperbaric oxygen therapy is essentially a way to try and flood that environment with the oxygen that's desperately needed, giving those tissues a better shot at repair.
Exactly. And maybe the thought to leave with is this. When you're facing the incredibly difficult journey of recovery from severe trauma, things like access to specialized treatments like hyperbaric oxygen, and also the ongoing research to figure out exactly when and how best to use them. These really are critical pieces of that complex recovery puzzle.